Hi, Leah.
Hi, Lisa. How are you today?
Good. I'm just getting ready for my breast surgery that I'm having next week.
Oh my gosh, I can't believe it, Lisa. Are you excited?
I'm so excited. I mean, I'm so excited about everything. And I know that you've sat in on some of the surgery, so tell me, what should what happens when I'm under?
Well, the biggest thing that you can definitely count on is that you are in great hands with Dr. Wigoda. That's the most important thing, is that you realize you're in Dr. Wigoda's care and in his hands, and you've known him for quite some time now, so that should make you feel comfortable.
Definitely, definitely.
The other day, it was, I guess about a week ago, I was able to sit in and watch actually one of his procedures of doing the breast augmentation, which you're asking me about. So I was able to actually witness and actually see his technique that he uses. And he has a special technique that I had never known before that he uses that does not cause a lot of trauma to the body, therefore allowing the patient to feel virtually less pain, little to no pain at all because of the procedure that he's doing. And it is actually his technique that I was able to see that he takes his time and he uses special tools that traditionally other doctors haven't used to maybe take away from the time involved, is what their fear would be. And Dr. Wigoda doesn't rush the surgery, so he takes his time, he tries not to cause a lot of trauma to the body, therefore not having very much blood at all. I was completely amazed at the mere fact that I didn't even see any blood, and here he was starting a procedure, an operation, cutting somebody, and then the little bit that he even does, because it's a tiny incision, but still opening up the body, and I would have thought, oh my gosh, blood would have come pouring out or something would have happened, but he uses special equipment. He has a special, very gentle technique that I saw no blood at all. It was a beautiful, clean surgery. And
How long did the surgery take that you saw?
The one that the breast augmentation that I saw, I believe was 20 to 30 minutes from start to finish, and I'd have to double check that number, but I was just amazed at how, I think the average breast augmentation surgery is 45 minutes, but I was just amazed at how smooth and how well streamlined it was, from the anesthesiologist to the ER nurse that was also working on the case, and Dr. Wigoda, and then he had his surgical technologist that was in the room as well. So this is such a streamlined process that you would have thought they've done it for 100 years.
And you were telling me that they actually sat the girl up.
Yes. After Dr. Wigoda put the implants in, and he was able to gently build a pocket, do his magic and do his technique, he said, oh Leah, go around and go to the front and watch this. And so I was thinking, what am I going to see? And little by little they lifted this patient up, and she was then sitting upright, and I didn't know exactly what it was doing, but he wanted to go and make sure that everything was perfect. The shape, the size, the direction of the nipples, the way they were pointing, and he just a few adjustments. But as soon as they sat her up, I was like, wow, oh my goodness, it was just beautiful. An artist at work. I was very impressed.
Okay, Leah, that's awesome insight. I mean, who would know those type of details? I mean, to know what's happening behind the scenes while you're having breast augmentation or breast implants.
Exactly, and to be able to sit there and actually watch and witness the procedure being done, and how we're able to promote Dr. Wigoda in a way, because seeing is believing, and seeing this beautiful work. Lisa, you're going to be so excited.
I'm so excited. I just have a couple more weeks to wait and my surgery, and I'm going to take videos and blog my way through it. And I'm just looking at behind you is our article that Dr. Wigoda was featured in the New York Times, and they're all over the place.
Well, Dr. Wigoda certainly has had quite a bit of publicity during his the last 10, 11 years that he's been performing these procedures. And he also has the Aesthetics Institute that offers the injectables and our fillers, as well as the plastic surgery procedures that he does provide.
Okay, thanks Leah for sharing.
You're welcome. Bye.
Bye.